during the Monday Night Football game between the Buffalo Bills and the host Cincinnati Bengals, when one of their players, Damar Hamlin, collapsed on the field after a tackle. Immediately CPR was performed on him. We now know he had a heart attack. We don't know much more than that, other than that he's in his vitals have returned to normal. He needed a ventilator for a while, but they did resuscitate him, and we do not know much more about his medical condition, the causes, or his future. But we're going to speculate a little bit on that today in just a minute when I bring on Dr. Andrew Bostom. He has talked to a cardiologist. I have a close, one of the top rhythmic heart specialists in the world I've contacted today. We're going to review some of their thoughts, and we're going to give you what we know about it all. First of all, some disclaimers. Certainly not me. And Dr. Bostom is a learned researcher and epidemiologist, nor is he a heart specialist per se, but he knows his stuff. He knows his medicine. We don't know all the info again, so we are speculating, but this is informed speculation and informed analysis. I want to show you just quickly before I bring on Dr. Bostom and have him comment on this. I want to show you a tweet I put out last night, which is the leading theory about what's going on. And if you look at the bottom here, I remember the discussion years ago about protecting little leaguers with vests because there was concerns about getting hit with a pitch ball in the chest and that some kids were dying or suffering heart attacks. And I was wondering, because it looked like a shoulder to the chest last night to Damar Hamlin, and I was wondering if it's the same thing. And this is my cardiologist source, Dr. Leon, one of the top cardiologists with regard to rhythms of the heart. He said, yes, focal trauma to the chest at a critical time can induce such a heart condition. If that's what it is, he says he'll likely recover, and he reinforced that, yep, a few kids every year are killed around the country, baseball, hockey, lacrosse. So let's bring in Dr. Andrew Bostom and get his thoughts on all this. Andy, welcome back to In the Dugout and our quick pitch update. Having said all that, your initial thoughts.
Well, I think commotio cordis, which is this trauma to the heart. First of all, it is an exceedingly rare condition. For example, I pulled up a paper that looked at fatalities in high school and college football players, 243 football fatalities. This is a period of 20 years, essentially 1990 through June 2010. And there were only 7 out of those 243 fatalities that were due to, or thought to be due to commotio cordis. In an earlier study, that was larger, a database put together by, I think, one of the leading researchers in this field, Dr. Barry Marin. This was just called Sudden Deaths in Young Competitive Athletes, 1980 to 2006. The leading causes by far of sudden death were things that we've come to be somewhat familiar with through high-profile athletes. The leading cause is hypertrophic cardiomyopathy, which is it's a thickening of the walls of the heart in such a way that the blood flow is obstructed. It also can trigger arrhythmias because of the altered anatomy. And that's what killed, ultimately, on autopsy, it was discovered, that's what killed Reggie Lewis, the former Celtic star. And then the second most common cause of these cardiovascular deaths is something called a single right coronary artery. So the actual blood flow to the heart is congenitally, abnormal and more prone to mild obstruction can cause much more serious disease.
Let me be clear. Fortunately, we're not talking about a death here last night, but it was a near death, CPR, And certainly in almost in any heart attack situation, Doc, right? The ability to get CPR and what do you call those machines, on him.
The
Um,
defibrillators, the automated defibrillators.
yeah,
Yeah,
within minutes.
Mike, I'm a little concerned though because here's what's going on. Now we can't
Okay.
tell yet because we have to wait for the. We really need data. We really need information. We have to wait for the press conference update. But now it is possible that the resuscitation, which clearly restored his pumping function, his heart rhythm. Um, he's still intubated, and there's some question as to whether or not he's capable of spontaneously breathing. In other words, did he suffer a brain injury, which now will not allow him to breathe spontaneously? Um, uh, because if he's on a ventilator and he's heavily sedated, it's very difficult to determine if there's spontaneous breathing, that's residual. They can lighten the sedation and see if he breathes spontaneously. And it's not unusual for someone to be intubated after a cardiac arrest the way he had. But I'm getting concerned that I'm not hearing reports, and maybe they're just, it's a blackout, about whether or not he has the ability to breathe spontaneously. Because if he doesn't have the ability to breathe spontaneously, then that would suggest he might have unfortunately sustained a brain injury, which impaired the respiratory.
Right. The question is how long did the heart stop pumping oxygen to his brain, right? Yeah.
Exactly. So it's very hard to tell with the sedation and the absolute, the sort of so far the moratorium on reports. But getting back to what the leading causes
Yeah,
are.
now you talk to a heart specialist of
Right.
your own, right? Who right? Who
Right.
who was that?
And that's Anish Koka, who's a very prominent cardiologist in the Philadelphia area. And his point was that of course you could conclude, in the end it may be concluded that it was this chest wall trauma. However, that's basically a diagnosis, what we call a diagnosis of exclusion. You would have to rule out all the more common possibilities. And like I mentioned too, this hypertrophic cardiomyopathy, which Reggie Lewis died from, the abnormal coronary anatomy, which Pete Maravich died from. And then there are other things in between. One of them is myocarditis. Now that, of course, raises the verboten issue.
Yeah, we'll get back. We'll
Yeah,
get to that in a second. We'll get to that in
yeah.
a second. So let me ask you. I don't know if your friend weighed in, your doctor, cardiologist, or your more learned estimation than mine, but based on what you saw on the field, how it transpired, what you know about commotio cordis, what chances would you give that that was the cause of what happened?
I mean, it really is hard to say at this point with the absence of information we have that it couldn't be commotio cordis. It's happened in football players. The classic form was thought to be an unprotected chest with a baseball hitting it, or at high speed, or a hockey puck in hockey,
Right.
or a lacrosse ball. With the chest unprotected. But on the other hand, both in high school and college and professional athletes, there have been in football, there have been cases reported, very, very rare, Mike, where this is believed to have been the cause of
Yep.
death.
Let me
And,
show you.
and one of the things, Mike, is that there's long been a debate about are there adequate ways to protect the chest? And
I want to get to that in a second. I want to get to that in a second too, for sure. But I saw this chart
right.
from some doctor that this whole continuum here is basically, if you figure one beat a second, roughly 1 second, and for that focal impact to have an effect, it has to happen in this very narrow band. It looks like within 1/10 of a second, 1/15 of a second of the
Exactly.
normal heartbeat.
This is a classic depiction of the surface wave that you get when you get an electrocardiogram, and
Okay.
the PQRS and T complexes. And the heart is in a very vulnerable position during that T. If you want to hold that up again, Mike.
Yeah, I
During
will. Oh, yep.
during
Hold on.
that during that T wave phase, it's repolarizing, the impact then could trigger an abnormal rhythm in that vulnerable phase of what's called repolarization, and then trigger fatal arrhythmias, things that are just very chaotic, like ventricular fibrillation in particular. So it is possible, but in other words, it takes an exquisitely, badly timed incident to trigger that kind of arrhythmia.
All right. Okay, great. All right. Now, you saw a post somewhere, a report that the player's agent, Hamlin's agent, said it's an uncomplicated
No, he didn't
cardiac
say
arrest.
uncomplicated. He just, the way he described it, it
Okay.
sounded relatively uncomplicated.
All right. And
So that
we know his vitals are back to stable. Does that give you any clue?
It could, except for this issue of whether it's critical, Mike, whether or not he's capable of breathing spontaneously.
Okay.
Now, even if he's not, people have recovered, without have recovered their ability to breathe spontaneously. But if it was simple and cut and dried, and they were just protecting him with sedation, you'd be more reassured if and maybe we will be at the press conference where they say, oh no, he's shown signs of being able to breathe spontaneously. That would be
All
really
right.
important in terms of brain damage.
Got it. All right. Great point. All right. Let's get into some theories here. We've seen already in short order, almost immediately, the far left, the far right coming out with theories. I think where you were going, well, here's a guy we all, I think, respect. I don't know that I respect that he put this out, but he used the word considered. Is myocarditis should be considered for a 24-year-old? Again, the implication, I think, here is that COVID vaccine induced myocarditis. I think it's irresponsible to suggest that. I don't know if it's irresponsible to suggest that be considered or not. But your thought on it, and then there was some reaction by those on the left who want to automatically dismiss any consideration
Right.
of that.
So,
Go ahead, Doc.
so I think I think Peter has raised some important issues, certainly in terms of what I was just saying. He hasn't heard any evidence in terms of the prognosis. Forgetting about what it is in terms of the prognosis and restoring Damar to to a good quality of life. He's concerned, like I am, that there's no reports yet of spontaneous breathing. Now, again, that could be from the sedation. As far as Peter's focus on, so if we're going to talk about vaccination, then we might be talking about the risk for myocarditis in a young man in relation to vaccination. We could actually be talking about, if this had happened, about the risk for thrombosis perhaps and heart attack, myocardial infarction. But Peter, I think, was focusing
thrombosis being a blood clot, right?
Clot in one of the coronary arteries that can trigger a heart attack. Peter, I think, was suggesting that look, we've got this problem of clinical and subclinical myocarditis, particularly with the mRNA vaccines. I think it is reasonable to think about whether or not Damar was boosted or whatever in the last month or so. But you have to, again, realize that myocarditis itself is, at least in these series that have been done on athletes by Dr. Marin, by this study of high school and college athletes, myocarditis itself is not that common a cause of sudden cardiac death. And we have to say, Mike, if he arrested, even if he's resuscitated, he's been resuscitated, but if he's resuscitated fully, it's still considered an episode of sudden cardiac death.
Let me ask you this: if it's myocarditis or something other than commotio cordis, could that be triggered by a blow to the chest?
Well, that's the thing. Was he? I mean, I think that's a reasonable.
Or could it have just been completely coincidental to it?
Right, exactly. So those are the things that are going to be very difficult to sort out. Was he predisposed to a fatal rhythm abnormality because he had some smoldering myocarditis, or was it he had something more common, like a hypertrophic cardiomyopathy, like some sort of coronary artery abnormality? So all this is going to have to be teased out, and some of the tests that he undergoes now should
Right.
help. Like certainly, if there's
Yeah. Yeah.
no,
And
if there's
again,
no,
we don't know. We don't have the data. We don't know his
right,
background. We don't know any of that. Like you said, we don't know how much medication he's on, whether he's breathing on his own. So we're purely speculating
it's
here. All right, let's
really,
look at
it's
yeah.
really speculation
All right,
at this
let's look at some
point.
data you wanted to bring up in this discussion. I'll leave this up for a while. Tell us why this is
Well, I
important and
mean, again,
relates.
if it turned out that the more common causes of sudden cardiac deaths, cardiac arrest in a young athlete were ruled out, again, the hypertrophic cardiomyopathy, the congenital coronary abnormalities, if that was ruled out, then myocarditis is on the differential, a differential diagnosis of what could be the cause, and these are data from Rhode Island. Now, if you recall, Mike, we discussed in relation to that case that I still believe strongly was from Brown University, and I believe the Brown University student has been written up anonymously in Rhode Island literature. This is actually a follow-up of 9 out of the 14 cases that the Rhode Island Cardiology Group had acknowledged were cases of vaccine-induced myocarditis during 2021. And what's concerning is that with 3 to 6 month follow-up in this group, there's evidence of persistent, and I would say more than inflammation. The marker that they use, it's a marker from magnetic resonance imaging, from MR. It's called late gadolinium enhancement. That is not only a marker. By the time you get into a recovery phase, that's a marker of actual tissue death, necrosis, fibrosis. That can be a site where you can generate that can help trigger abnormal rhythms. And then the other thing is that there's more sophisticated measures of the pumping capability, the way the heart can contract both, in this, it's called circumferential. So in this plane, and then the way the heart can contract in this plane, longitudinal strain, and those indices, again, 3 to 6 months out, are off. Both of those indices, those MR indices, have been used to prognosticate patients with all forms of myocarditis. And long term, they predict complications. So we just don't know. Thank God,
Okay.
so far in the 3 to 6 months, the young men haven't come back into the hospital with heart failure
All right.
but long term, it raises the question.
All right. Let's go long term for this athlete, Damar Hamlin. If you're not qualified to
Right.
ask this, if it was the commotio cordis and his vital signs are back and they get him back on rhythm, is he likely to have lasting effects? Do you think he would need a pacemaker or some kind of medication to
Yeah,
ensure normal
I
rhythm?
think we're, in the absence of information at this point. I think it's really hard to say.
Okay.
And I think the prudent thing in his case, if he survives this, and recovers to the extent where he would be theoretically capable of returning to football. I mean, I think that would be a huge hurdle unless all kinds of other things had been ruled out and he was looking, really like fully recovered. It would be a real. I mean, we have some bad. I mean, the Reggie Lewis case is a real red flag about that. Where he was quote unquote medically cleared, and it turned out, he suffered another arrest which was fatal, and he wound up having an undiagnosed hypertrophic cardiomyopathy.
Let's
So
go to one last area. Thank you, Doc. And this is purely speculative, but again, we talked about we know there's going to be a panic among advocates uh, for child safety, and among parents is going to be fear
oh,
mongering. I think, just like we had 8-10 years ago when there was this kind of mania to have all kids wear protective
for
equipment
baseball,
or rubber within their t-shirts in case they got hit by a hockey puck or a lacrosse ball or a baseball.
yeah,
All those discussions are going to come back. The fear
yeah,
mongering is clearly going to begin. But the lesson is, look, all sports have risks, right? A, B, with defibrillators as prevalent as they are in
yeah.
stadiums, they should be at every sports field. And then maybe wear protective equipment, but not from a fear mongering point of view. I don't know. Do you think there's
Mike,
got
I
to be a
couldn't.
threat to children's sports here?
I don't know what the update has been from the era of the papers I was reading, 2006 to basically 2012. But the certainly the 2006 paper said that it was pretty futile to try and incorporate, chest protection.
Right.
That it really wasn't. There was the materials then, at least, were not going to be able to alter the course of a blunt trauma like that in any significant way that would prevent the trauma induced arrhythmia. And so I do agree with you that the real solution to this is to have more automated defibrillators present at these sporting events and train people how to use them. They're very straightforward to use. They've been used very successfully, and hopefully, Damar will come out of this, and certainly, they got him back into a stable rhythm. The question is, was it done fast enough? And
Yeah.
that's really the tragedy here. And
Yeah.
and I mean, obviously they tried to, they were on him very quickly. But we'll have to see. I hope the press conference gives us some information.
Yeah. Again, so many questions, so much information we don't know. That's why I want to reinforce this is pure informed speculation, informed analysis. We don't know all the facts surrounding this case in Damar Hamlin's medical history or his future.
But I do know, Mike, there's this polarization which is really uncomfortable.
Yeah.
That if you don't immediately say, oh, it's a commotio cordis, and that actually, Mike, I mean, you can align it pretty strongly with people that are very, very strong pro-vax vaccination.
They don't want anyone.
They don't want anything other than commotio cordis.
Might have played a role.
Well,
right?
It's worse. They don't want anything other than commotio cordis. I mean, they're really pushing that very heavily. And then there are people that are, completely dismissive of even the possibility of commotio cordis, which is, again, not a high probability. And all they want to talk about is, his vaccine status, and they're convinced
both positions are highly irresponsible, right?
I think so. I think so. At this point, we just don't know very much.
Right.
Other than this, the tragic event itself, we really don't know very much.
All right, Dr. Andy Boston, thank you for joining us, providing us with that saged medical perspective on all this. And I remind our viewers to tune in at 4 o'clock today. If there's updated information, we'll have that for you on our normal In the Dugout time slot today at 4 p.m. I've got some other comments. I've got a personal story to tell about an on-the-field death that I actually broadcast in 1996. So I will tell that story at 4 o'clock today. Dr. Boston, thanks again for joining us. And we will see you at 4 o'clock today. Mike Stenhouse out for In the Dugout.